Hello, this is Dr. Usman, and today I'm going to talk about a very interesting topic. And I have experienced it myself also, and I have heard people talking about it, so I thought to bring it to the notice of the people. And it's an educational video. Of course, we all know about that. Uh, so it's called Demon in My Room. What I've heard people saying about it, the experience is that they feel like there was a demon in the room. There was a demon sleeping with them. There was a demon sitting on their chest. There was a demon trying to touch them, feel them. And they were able to feel. They were able to do everything. And all of a sudden, it's a frightening moment in your life. And you really do not want that. People are scared to death. People have anxiety. People have suicidality from this thing that I'm going to talk to you guys today. It's called sleep paralysis. It's basically a condition in which you have literally got paralysis. You can't talk, you can't walk, you can't move, but you're awake. Why it happens? Why it happens? There is a scientific background. It's not a demon. That's why, it's based on the cultures. It's based on the cultures, how you relate to it, how you tag it, how you talk about it, and how you experience it, and how you keep experiencing it in the future. It depends. Most of us get it at least once in life. Most of us, not all of us. So what happens? You have paralysis, as I told. You can't do anything, but your brain is awake. You are feeling something going on. And then you have fear, you have panic, you have delusions, you have hallucinations, you have all sort of feelings, but you cannot talk. You are like in a cage. You are like stuck, and somebody is squeezing you and sitting on you and grabbing you, and you can't do anything. That is a sleep paralysis, which is like a demon in the bedroom. And your brain is sending the signals to relax the muscles. And that's why you cannot move. And that's why we call it atonia. You have lack of tone. You can't do anything. But, you are not even able to speak. You are still breathing. That's a good thing. If it reaches that level that you are not even able to breathe, you have to see a medical doctor. I'm telling you. So, uh, 75% of the sleep paralysis, they involve hallucinations, which could be auditory, like you listen things, which could be tactile, like you feel them on your body. It depends what sort of hallucinations they are. It could be something listening. It could be just a pressure related thing, like something sitting on your chest and you're about to pass out. You're sweating. You're really sweating to your nerves. So, and again, that's what I was talking about. Cultural context. It depends. If you have a scientific background, you will Google and find out that what's the reason behind that. But if you have, you know, other cultural backgrounds, they have different things. They bring about other things, and that may help. It depends. Every culture has some good things, and that can help. Definitely can help. I'm not against other cultures. I'm not against any culture in the world. Let's put it this way. What causes that? Good sleep habits are really important. 38% of the people have a very high rate because they have obstructive sleep apnea. They snore. They snore. They don't have a quality sleep. They have, therefore, a lack of neurons that can protect them from this kind of things. And a lot of things can happen. And it can keep happening and again and again. And it can also happen with the breathing problem. And in that case, you have to see a doctor. Another important thing is excessive daytime sleepiness. If you're sleeping a lot during the day, or if you are sleepy during the day, it means you have a high risk of getting this kind of problem. Or if you're a traveler, some people travel on business trips, business rounds, and things like that. So in that case, you keep having jet lag. And in that jet lag, you have your changes in your posture of the sleep, changes in your sleep patterns, sleep cycles, and all of those neuronal signals coming from the brain, your circadian rhythms, which keep you in a specific shape. Your sleep cycles are extremely important. Someday I will definitely talk about that. I do not want to stretch it too long. I'm just touching the surface. PTSD, some people have some traumatic event in their life and then it happens. Loss of loved one can happen if you lose somebody, and it can even happen to you. Let's say somebody in your family died, and you are under that trauma in your brain, that you are under that stress, and your brain is unable to get rid of it, but brain is trying to relax you. So it's sending some signals to your body to relax. That does relax your muscles, but there are certain things that are still not relaxed, and one of them is sleep paralysis. That's why it happens that your nerves, your neurons, are keeping you awake. It's called REM, rapid eye movement. That's a type of a sleep that you're experiencing in this type of paralysis, and then you experience all of this. Some people with anxieties, they also have increased chances of getting that. If you have more anxiety episodes, you have more chances of getting sleep paralysis, and you're getting gonna get more hallucinations and delusions and illusions and things like that. Excuse me. So it's a dissociative property. It's a dissociative sense. So try to seek a medical attention if you're getting in that phase. And how to avoid it? You need a good sleep time, good bedtime, good mattress, good comfort in your sleep, and you need a good environment to sleep. You need a good daylight exposure. So during the day, it is quite often to find this thing in people who do night shifts and they don't sleep well. It is quite because their cycles, the sleep cycles are affected, their circadian rhythms are affected, their hormones are affected. It's a huge medicine. It's called sleep medicine. It covers everything. So it does happen like that. And you will see people around you going through these things, and it's quite miserable at certain stages. So try to follow these patterns. Avoid caffeine. Avoid caffeine in the evening time, especially alcohol. You should avoid that anyways. It's pretty unhealthy thing. It's quite unhealthy. Uh, and we can talk about that in future. And there you do not do exercise within 2 hours of the bedtime. You do it every day. Try to do exercise every day. That's going to be really helpful, but don't do it 2 hours before bedtime. I see some people doing workout, go to the gym like 10 p.m. and going to bed at 11 p.m. No, that's gonna increase the risk of this thing. And if this thing is happening, there are some other things going on in your life as well, as I have talked about. Electronics, electronics, that's a very big dilemma today. Who amongst us sleeps without a cell phone, without looking at the cell phone, and not having a cell phone at the bed? Who is it? I am asking everybody here. So you have to avoid using the cell phone within 1 hour of your bedtime. That's when you stop doing it. Stop using your cell phone at that time. So if you're having these episodes on regular basis, or you're going through anxiety and you're having some pre falling asleep problems, or you're snoring during the day or snoring at night, or falling asleep during the day, falling short on your sleep cycles, in all those situations you have to see a sleep specialist, or at least your physician. So, I've already talked about sleep hygiene, sleeping tips, bed mattress, avoiding caffeine, avoiding electronic devices. If those things don't happen, sorry, we need some therapy, and sleep specialist and psychiatrist and psychologist, they can do those things for you, and seek a medical advice on that. Thank you so much. Please like, subscribe, and share.